four-time Miss Olympia Jay Cutler. Welcome to my channel, Jay Cutler TV, and make sure to stay in tune with the newest and updated videos. Subscribe below, guys. Thank you so much for following along.
All right, you guys, this is Dave Max 6 here with Dr. Ren in Santa Monica, and we are back with Ask the Doc. We have a whole new slew of new questions, Doc, and you actually like them a lot. They're becoming more interesting to you, which I'm glad to hear also. So we're going to get started. You take it from here.
Yeah, no, they're always interesting, but we got some fresh looks, some new ones, some more interesting ones in the sense that they're not the standard mainstream questions. So, yeah, thanks for sending them ahead, and I'll start with reading the first one.
Yeah.
Hi guys, great job on the show. Appreciate the very practical health knowledge you provide every week. Thank you for that. Two quick questions I had. One, what was the protocol of the TRT cycling used on the prostate cancer patients you mentioned on the previous show? That one was in the Science of Translational Medicine journal, and it involved, it was a small study. It was an N of 16, so a number of patients were 16, and it was to treat extant prostate cancer with, they called it bipolar testosterone. So they were using 400 milligrams every 28 days of testosterone cypionate, which would not be a replacement dose, and you would be on a roller coaster ride if that were, for replacement. But the idea was well, I don't know what the from where the idea came, but this cycling of high dose testosterone followed by obviously low dose after probably 2 weeks you were probably in the tank again, then you had 2 weeks of low dose. It was also accompanied by an anti-cancer drug. I want to say it was started with an E, but anyway, it wasn't just by itself. It was a drug that's normally used for a lot of different cancers like sarcoma and testicular cancer, not prostate cancer at all typically, but it's a chemotherapy drug. So chemotherapy works by, and it's kind of counterintuitive, by killing the cancer cells faster than regular cells, because cancer cells replicate so much more quickly than normal healthy cells. And you got to think about that one for a second. But if you talk to people who've been through chemotherapy, they'll say, yeah, beat the cancer, I survived it. Thank God the chemotherapy killed the cancer before it killed me.
Right.
But again, it's kind of counterintuitive. But think about, the cancer replicates very quickly while this one cell is replicating much more slowly. And so the chemotherapy kills in different ways, depending on the cancer drug. It stops that replication process and kills the cells. So these die out more quickly, hopefully and typically, than the healthy cell, which you almost kill at some point, but okay, the cancer's done, we stopped the chemo and we still got some healthy cells.
No, that's
so we won't be healthy. Caveats that, this is just fun facts, chemotherapy is not always the safest thing. It may be the only option though, because for example with breast cancer, the chemotherapy often can result in, you beat the breast cancer, but you end up with like leukemia, AML. So there's usually some trade-off. Anyway, well, and as far as cancer goes, treating prostate cancer, got to be careful how we talk about treating cancer, especially as a doctor. You may read, however, on the internet various studies that use extracts of green tea. In fact, when talking with my patients about cancer, it's fascinating to me. If you just type in green tea extract, cancer, typically you'll get anywhere from whatever Dr. Google is searching through at the time, 750,000 to 1,250,000 articles on the successful treatment of cancers using green tea.
Wow.
I'm using the word treatment. You judge by yourself. I'm not making any claims here.
Yeah.
But the use of there's actually a product called Capsol Tea, CAPSOL-T, and they have a TSR version. The idea is one's delayed release, the other is normal release. But the idea is to have a titer of green tea extract. And we were talking about chemotherapy. the green tea extract. There's something called epigallocatechin 3 gallate, which is yeah, I know. In case you're on Jeopardy, actually, they probably won't even have the question that goes that in depth. But that's really sort of the active ingredient in green tea. But it acts like I call it chemotherapy light, and that may or may not be the reason why some cultures drink a lot of it. I mean, there are other benefits to the use of green teas and other products that have all kinds of nutrients in it. But it acts like like chemotherapy light in that it can be converted, and this is better dealt with like with an organic chemist or a biochemist who can explain the mechanisms. But it acts to actually disrupt the replication of DNA. So again, I call it chemotherapy light. It's not enough to have like major side effects. As a matter of fact, the side effects are usually good. You get a little upper buzz with the things like caffeine, not theobromine. That's in chocolate, but theophylline. I'm sorry. The alkaloids. I was trying to find the word. They give you that pep. But anyway. I'm digressing too much, but to treat that, I would also include. He's not asking me about treating prostate cancer, I hope. Anyway, we've had success. I'll just throw it out there as a side note. Treating cancers by eliminating high sugar. So metformin, you'll read about maybe. I think there's a question about metformin in here this week. If so, I'll save it for then. Anyway, but a ketogenic diet. All these things are good to fight cancers in general, or to help with the treatment of cancer. Anyway, he asks. Any advice on what to take to promote healing after bilateral inguinal hernia surgery? Bilateral inguinal hernia surgery. Wow.
And this is why I don't read the questions.
Yeah, the first thing to promote healing is ice. Everyone likes to blow that one off because no one likes to put ice on their skin or wherever they need to put it, because it typically hurts for the first anywhere up to 8-9 minutes, depending on where you put it too. But ice, I've seen people cut the healing time in half.
Wow.
I was doing surgery rotations. You'll see all kinds of abdominal surgeries, whether it's an appendix removal or a hernia repair. And the guys that were good with the ice, seriously, 3 weeks later, like, yeah, I'm doing great, doc.
Wow.
The guys that didn't, 6 weeks later, yeah, I still kind of got some adhesions, whatever. So that's the first. Also things like L-glutamine. Of course, you're trying to repair tissue, so collagen is formed by what? Protein and vitamin C. Vitamin C, you could throw in some N-acetylcysteine, which converts in the liver to glutathione, all antioxidants, things to help keep it protected from bacteria, but also to help it heal. The vitamin C and protein are mainly to help it heal. The glutamine too helps heal epithelial tissue, even columnar tissue. And all these things have science behind it. I wouldn't be talking about it if it weren't, but you could look them up, in other words. And then how about anything to promote the release of growth hormone? We have those peptides now that are legal to prescribe in the United States. GHRP, the growth hormone releasing peptides 2 and 6, beware they can cause hunger. Ipamorelin also can cause hunger, but another peptide, sermorelin, growth hormone releasing hormone analog, and ibutamorin, which is my favorite because it's a peptidomimetic. You can take it by mouth. And I've seen great results getting your IGF-1, which is a reflection of your growth hormone release, up over 300 for sure. I had 2 patients today with levels over 400.
Wow.
In IGF-1. That's pretty high. Typically, you're not producing more than, say, 300, 350, even in your teen years. So
wow.
All those could help heal post-surgically. He says, I was planning on changing my TRT from 200 milligrams of testosterone to 100 milligrams of testosterone and 100 milligrams of decadurabolin. I had my growth hormone tested and my natural levels are way off the chart, so I'm not going to supplement growth hormone. Thanks huge for your wisdom and the great show. Scott from Canada. Scott. All right, so I get no question there, but so I don't know if this is in reference to a personal issue with either prostate cancer or hernia surgery, but anyway, my answer stands. In other words, I'm not sure how. Decadurabolin and test combination as opposed to testosterone, that's not going to help you heal the surgical wound, but it certainly could help heal where any muscular tissue would be separated to get to anything you're trying to get to in any surgery. How's that? Not the first choice in terms of repair, again, unless you're going through muscle tissue. More, I think I would focus on his natural levels of growth hormone / IGF-1 or anything to promote that, I think, for healing a surgical wound. Okay?
Gotcha.
You want to go to number 2?
Is that what? No. Oh, yeah. There's
keep
more.
it rolling.
There, yeah, go. Go ahead.
So he's this next
They're milking it.
gentleman says.
Oh, hold on. Oh, okay. So we're doing question 1.
Yeah.
Okay.
You can edit that.